partner with oncologists to help patients dealing with cancer to preserve their fertility in a time-sensitive manner. And today on Lunchtime Live with the Center, we are talking with Dr. Daniel Groh about Oncofertility, what it is, your options, how we partner with your oncology team, and how fertility preservation works. Dr. Groh, hi, welcome back.
Hi, Ami, thanks for having me. It's really a pleasure to be here.
Oh, you're welcome. Can we talk about what is oncofertility? What does that term even mean?
It really means fertility preservation for patients with a cancer diagnosis.
Okay.
And so we see many men and women who are of reproductive age that have cancer diagnoses. There's about 150,000 of them every year in the United States. And we can help them save some eggs or sperm for the future.
Excellent. So both men and women can participate in this. Can cancer treatments impact male fertility?
So there's several chemotherapy drugs, not all of them certainly, but several of them have pretty toxic effects on the testicles and the ovaries. And if you take these drugs to help save your life to stop the cancer from growing, sometimes it irreversibly affects the ovaries or the testicles so that they don't make eggs or sperm for the future. And so to prevent that damage or to prevent loss of fertility, we can freeze sperm or we can freeze eggs for the future.
So for male fertility preservation options, that is in effect freezing sperm.
Correct.
Okay. And would you be meeting with the patient, or would that be a different person? If it's a male?
Yeah, it's much easier if it's a male than if it's a female. And typically the man's oncologist, and sometimes these are teenagers or young men, his oncologist would just call our center and order a sperm freeze.
Okay.
And the patient would just come to our center and give a sperm sample. That sample usually has millions of sperm in it, and they'll fractionate that sample into 5 or as many as 10 different vials, freeze each vial for the future so that each vial has some potential to fertilize eggs for the future.
And would this person have to see you or any of our other doctors?
No, so for men, because they can collect on their own, we as physicians at the center don't get involved, but their urologist or their medical oncologist can contact the center directly and make arrangements for their patient to freeze some sperm. We do it frequently. We may freeze 1 or 2 sperm samples for men weekly for cancer diagnoses. So it happens pretty often.
Okay. Now, what about, let's flip to female fertility options or female cancer treatment options that impact fertility. How can cancer treatments impact female fertility?
Yeah, so the most common medicine that is very toxic to ovaries, which is most frequently used for breast cancer chemotherapy, is an alkylating agent. And these agents bind DNA and cause cross-links in DNA, and then DNA breaks. And so when these agents affect the ovaries, it destroys many of the eggs that are present in the ovary. And in a small percentage of women, they'll go into menopause immediately after their chemotherapy. Wow. And their ovaries won't lead to ovulation or menstruation again. In some patients, the ovaries recover, and in a year or 2, they start to ovulate again. And different chemotherapeutic agents have different toxicities on the ovaries. And so we'll see these patients, in concert with their medical oncologist, who will typically refer them to see us. and help them freeze eggs.
Okay.
Oftentimes, the patients are pretty surprised with their cancer diagnosis, and they're pretty tuned in to wanting to get their chemotherapy started quickly.
Mm-hmm.
So we have a pretty narrow window by which we can start the egg freezing process. It takes about 2 weeks from start to finish for us to give some medicine to the patient to stimulate her ovaries. We do some monitoring, retrieve 10 or 20 eggs or more sometimes, and can freeze those eggs for the future.
And what about embryos? Should someone consider freezing embryos over eggs?
Yeah, that's a really great question because for decades we've frozen embryos very successfully, in the infertility world, and we can still freeze embryos very successfully. In 2012 in the United States, egg freezing was taken off the experimental list. And in the last decade, it's become very, very common to freeze eggs. And our success rates with egg freezing has really increased. So a quick example of that, for patients who need donor egg, their ovaries aren't working anymore and they want to have a child and they need donor egg, we used to have to recruit a fresh live donor from the local area and stimulate their ovaries and retrieve their eggs and use them fresh, not frozen. Now, with donor egg, a recipient will simply go online and choose a donor from an egg bank, and they'll ship a half a dozen frozen eggs to our center. So this technology has become very mainstream, very reproducible, and the eggs survive the freeze and thaw quite well. They fertilize at a high rate after they're thawed. They develop embryos and blastocysts and have a real chance of pregnancy.
So they survive the freeze and thaw. Is there a time limit? How long are frozen sperm and eggs or embryos good for?
Yeah, that's a great question because we think of our own freezer, right? But freezing egg and sperm is much different. They're frozen in liquid nitrogen, which is very, very cold, approximately minus 270 degrees. So very, very cold. And they become in this almost inert state. So theoretically, they could be frozen almost forever.
Okay.
But we typically think in terms of freezing them for 5 or 10 or 15 years.
So you had mentioned this needs to happen over 2 weeks for women. Treatment for cancer often starts ASAP. So it's time sensitive. How quickly can we see someone?
That's a great question. We have really streamlined our service here at UConn and CARS. We have a hotline that's available 24/7. That during the day it's answered live. In the evening it's answered by a service, and we'll get back to the patient the next morning. We virtually guarantee an appointment within 24 hours.
Oh, excellent.
And myself or one of my colleagues will see the patient by telehealth, a visit, or in person. We'll do the necessary testing, and often we can have them ready to start freezing their eggs within 2 or 3 days.
Wow.
So it's a very streamlined service for this very special group of patients.
And who would call the hotline? Would the patient call the hotline?
Typically the oncology group would call the hotline.
Okay.
Or the patients can call the hotline, but our regional oncology groups have the phone number.
Okay. Excellent. You mentioned cancer medications, especially breast cancer. Are there other medications that treat other diseases? Are there any other medical diagnoses where the treatment may impact reproductive health that you're aware of?
Yeah. I would say the cancer is a big one,
Yeah.
right? And it's our most common one. Sometimes patients with autoimmune diseases are on chemotherapeutic agents that over time could potentially affect the ovaries.
Mm.
So sometimes we think about it then. Sometimes patients need surgery for pelvic disease where the ovaries could be affected.
Okay.
And so we think about it for patients then. Egg freezing is not just for cancer patients. I saw a patient this morning interested in egg freezing because she was 35 years of age, a very high functioning professional, and she just didn't see it in her future to have children in the next several years. So she wanted to freeze some eggs, to use maybe 5 years from now when the time is right for her.
So are treatments considered are they insurable? Are oncofertility treatments covered by insurance in Connecticut?
So in Connecticut, if you have a cancer diagnosis and you are slated to undergo therapy with a medicine that's going to potentially affect your ovaries adversely. So if you have a fully funded health plan, so you're not self-insured, then there's a state law that says that your plan must cover egg freezing.
Okay. Wow.
So it doesn't cover all of our patients, but it covers many of our patients. And for those patients who don't have insurance coverage, I know our center gives a discount, and there are organizations, for example, Live Strong, that have millions of dollars of grants set away, and they've helped many, many thousands of cancer patients do egg freezing, helping to pay for the medications.
That's excellent. That's really great, especially in this time where there's so much stress, so much anxiety going on with both with the cancer, but also trying to think about anything related to their fertility as well. I'm sure that's not necessarily what they're thinking about. So this is good information to know. Thank you for being here, Dr. Groh.
I wonder if I have time for a quick story.
Oh, great. Yeah, sure.
So we had a patient who's actually very near and dear to my heart, who I saw about 3 years ago. And she was 6 months postpartum, still breastfeeding. And she noticed a lump in her breast, which after imaging and testing turned out to be a breast cancer, an invasive ductal carcinoma. And so she was devastated. But I saw her because she was referred by her oncologist interested in freezing eggs. And we did it, and we saw her quickly, and we did a ovarian stimulation, and we froze 9 or 10 eggs for her. And then during that time, she had port placement for chemotherapy and underwent chemotherapy, and then bilateral mastectomy.
Wow.
And she went into remission, and she did not have metastatic disease. And she came back, presumably free of cancer, about 2 years later, saying that she wanted to have a child. And we were thrilled for her, but on testing, her ovaries really had suffered the effects of chemotherapy.
Okay.
And so we went ahead and we thawed her eggs, inseminated them with her husband's sperm, grew embryos, and she happened to be a BRCA carrier. Her cancer was probably due to a mutation in her BRCA gene. And so we tested the embryos both to make sure they were chromosomally normal and to see if they were carriers of the BRCA gene. And she had an embryo that was both normal and BRCA free. We transferred that embryo to her uterus. And about a month ago, she delivered a beautiful baby girl named Emma, who is BRCA free, and the couple is just as happy as they could ever be with Emma, and it's just a beautiful success story, I think, of what's possible for these patients.
That's a great story. That Science is amazing. It's just amazing that what you can do. And so that's a great story. And thank you for sharing that.
You're very welcome. Thank you for chatting with me today, Ami. It was really nice to see you again.
Nice to talk to you and see you too. And for anyone who is interested in learning more or has any questions, you can definitely visit our website at yukonfertility.com. And that's all for now. We will see you next week. So bye for now. I also just want to quickly mention the Oncofertility hotline, which is for the providers, the referring providers. I'll still mention the phone number as 860-470-7467, just in case.
Thanks.
So have a great day, and